Assessment of thorax and lungs, heart and central vessels, and breast and axilla.
Hi, good morning, Mom. I'm Crystal Joy Fang, your student nurse for today. And now we'll be assessing your thorax, lungs, breast, abdomen, and your heart. Is it okay with you, Mom? Okay, so before we start the assessment, I will be needing your 100% of participation to do an accurate assessment. Is it okay? Okay, so first I will be performing hand hygiene first and provide your reassurance and your privacy.
Perform hand hygiene. Provide clients privacy. Inspect the shape and symmetry of the thorax from posterior and lateral views. Observe position of scapula and the shape and configuration of the chest wall. Inspect alignment and deformities. The spine must be vertically aligned and the right and left shoulders and hips are of the same height. Palpate the posterior thorax. Palpation may be performed with one or both hands. Palpate the tenderness, warmth, pain, and other sensation. Palpate the posterior chest for respiratory excursion. Place hands on the posterior chest well with thumbs at the level of D9 or T10, and pressing together in a small skin fold. During deep respiration when assessing for the respiratory excursion. Palpate the chest for vocal tactile fremitus. Use the palmar surface of the hand at the base of the metacarpal for pharyngeal joints to assess for fremitus. As you move your hand to each area, ask the client to say 99. Assess all areas for symmetry and intensity of vibration. Fremitus should remain symmetric for bilateral positions. Percuss the thorax.
Mom, inhale, exhale ka po. Wait lang po. Inhale, exhale ka po.
Auscultate the chest using the flat disc diaphragm of the stethoscope. Place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung C7. Then ask the client to breathe deeply through her mouth for each area of auscultation, so you can best hear inspiratory and exploratory sounds.
Mom, breathe normally po.
Inspect breathing patterns. Respiration should be even and smooth. Chest movement should be symmetrical. Palpate the anterior chest. Palpate for tenderness, sensation, and surface masses. Start with your hand positioned over the left ventricle and move your hand left to right, comparing findings bilaterally.
Mom, breathe in, breathe out po kayo ng malalim. Tapos, slowly po, okay?
Palpate the anterior chest for respiratory excursion. Palpate tactile fremitus in the same manner as for the posterior chest.
99.
Percuss the anterior chest systematically. Percuss the apices above the clavicles and then percuss the intercostal spaces across and down comparing sides. Resonance is the percussion tone elicited over normal lung tissue.
Ma'am, hinga po kayo ng malalim.
Auscultate the anterior chest. First, place the diaphragm of the stethoscope firmly and directly on the anterior chest wall. Auscultate from the apices of the lungs slightly above the clavicles on the bases of the lungs on the sixth rib. Follow the sequence for anterior auscultation of the thorax. Document findings in the client's record. Assessment of the breast and axilla. Inspect the breast for size, symmetry and contour while the client is in a sitting position. Inspect the skin of the breast for localized discoloration or hyperpigmentation, refraction or dimpling, localized hypervascular areas, swelling or edema. Observe the breast for shape, surface character, and bilateral pull of suspensory ligaments. Emphasize any refraction by having the client raise arm above the head. Push the hands together with elbows flex and press the hands down on the hips. Inspect the areola area for size, shape, symmetry, color, surface characteristics, and any masses or lesions. Inspect the nipples for size, shape, position, color, discharge, and lesions. Palpate the axillary, supraclavicular, and intraclavicular lymph nodes. Note the presence of axillary hair. Confirm the axilla is free of redness, rashes, or lesions. Moving downward against the central aspect of the rib cage, continue to move down the posterior border and along the inner aspect of the upper arm. Using the pier and pressure in a small circular movements, palpate above and below the clavicle. Palpate the breast for masses, tenderness, and any discharge from the nipples. Ask the client to lie down. Cover the breast that is not being examined. Be sure to palpate the entire breast. Several patterns may be used, but the most common is concentric circle pattern. Start at the periphery of the breast and palpate into small circles until you reach the nipple. Try not to lift finger parts off the breast as you move one area to another. Palpation then continues into the tail of Spence. Palpate the areola and the nipples for masses. Confirm that the nipple is free of discharge that is non-tender and that the areola is free of masses. Document the findings on the client's record. Assessment of heart and central vessels. Simultaneously inspect and palpate the precordium for the presence of abnormal pulsations, lifts or heaves. There is no presence of heaves or lifts as I palpate her precordium. Auscultate the heart in all 5 key landmarks: aortic, pulmonic, Erb's point, tricuspid, and apical mitral. Begin auscultation using the diaphragm of the stethoscope for transmission of high-frequency sounds. Instruct to hold her breath. While the client holds her breath, the splitting disappears. Neutral bulb assess for S1. Palpate carotid artery. Palpate each carotid artery alternately by placing the pads of the index and middle fingers medial to the sternocleidomastoid muscles on the neck.
Ma'am, can you turn your head onto your left?
Inspect the jugular veins for distension. Shine a tangential light source under the neck to increase
Now to your
visualizations of pulsations to cast shadows in the client's neck. Observe for distension, protrusion, or bulging. Document findings in the client's record.